Hello, how are you? All the girls and beautiful ladies out there. Today I'm going to talk about UTI, which is a very common problem, urinary tract infection, and it has a lot of things to do with because being a female, you have a tendency to have urinary tract infections, and it usually comes with the symptoms like burning micturition and painful urination. That is the same thing. Secondly, you're not able to completely void or completely get your bladder emptying. There's a high risk of having a white discharge and pelvic inflammatory disease also along with it. So it is one of the painful situation in women nowadays because of traveling, because of high working schedules, and one don't get time to be hydrated properly, and using a public toilet is obviously a cause of having UTI. So how can we curb this problem or this disease? First of all, if you know how to use a pee cups, you can use that pee cups. It's a triangular cup which I'll show you in my video, and you can pee in that, and you can pee directly, and you can pee while standing also. So it's like peeing like a man. So this is one of the things you can do. Secondly, one can always follow a routine hygiene, which is like sitting on a commode by just spraying a sanitizer on it, which is commode sanitizer, and which is usually specifically made for this purpose. When you are using a public toilet, just spray on it, and after a minute, wait for a minute to act that antimicrobials on that germs, and then sit on it. Or if you can do, if you have a tissue paper, just wipe it the wet part of the commode and sit on it. And if you are good at squatting, if you don't have to pass motion or stool, you can obviously possible, and if you are comfortable, then you can even do a half squat and while peeing. So this is another method. So using a public toilet is one of the main causes of having urinary tract infection. Second cause is, yes, if you have a unprotected sexual intercourse. So, and you have a lot of in early marriages especially, when women are not able to drink properly water because they might be in their in-laws, and they have a lot of hormonal and psychological issues going on because you are into a new family with a partner and everything is new to your world. That time UTI is one of the common problem because you have become sexually active regularly. Secondly, drinking water, you are meeting new people, going places, going for honeymoons and all. You are not able to cope with your hydration part. So once you are not thinking about your hydration issues and all, then it can lead to a cause of urinary tract infection. So early marriages, yes, in early days in marriages, you have a problem in most of the women. I'm not saying everyone, but most of the women. Third main cause is, yes, less of water, and especially who are diabetic or prone to some infection, chronic infection. They, like, if you have a kidney disease, obviously you have more chances of having UTI. If you have diabetes, yes, you have more chances of having UTI. If you have any congenital problems of short urethra, something intravesical, some issues is there, some openings are there. So yes, it can be a cause of UTI. Fourth part is, if you are using diaper for some cause in old age people, because of the diaper, adult diaper, there is a chances of having urinary tract infection. So that can be another cause. But in early age, in a regular female who is in a reproductive age group, like till 50, 45, or who is very not in a middle age, their problems are different, and for urinary tract infection and another problems are different for the old age people. Then how to overcome this problem? First of all, have a lot of water, 3 to 4 liters of water. Secondly, have a syrup alcohol in a half glass of water every day in the afternoon or evening. and it is like it will alkalinize your urine, so it will help in urinary tract infection. And you can that bacteria which is growing over there, that will our own body will get rid of that bacteria if you just alkalinize your urine by having syrup alkazol. So it is easily available in the market. Some people also say that cranberry juice is also helpful. It is written in studies, but it has it is not used for the treatment. One can have a preventive measures by having cranberries or a juice of it if available. And then then there are some antibiotics. There is a course according to your severity of the disease. There is a 10 days course, 7 days course, 14 days course, 21 days course maximum of having nitrofurantoin. So we give it twice a day, and according to the severity of the disease, we'll see it. But before that, we do a urine checkup. Only a basic urine routine and urine culture is enough for UTI, if it is only pertaining to UTI. If you have more than that, yes, then we can have an ultrasound done of kidney, of uterus, of kidney, urinary bladder. Then we can also have CBC and TLCs, KFTs, and all these tests. But if you are not having fever and you are only having dysuria, that is painful urination or some kind of discharge, or not able to completely get empty while passing urine, so dribbling of urine, all these issues are there, then surely get a urine routine and a urine culture. Culture reports usually come late, so you after urine routine you get to know that you have a urinary infection. You can start with the antibiotic after consulting your physician. So it is usually a 10 days course, because it takes time for a urinary tract infection to come back and to get eradicated from the body completely. So it is usually a 10 days course, but yes, 7 to 10 days it varies. And maximum days course, if it is a chronic UTI and you are having again and again, then 21 days course. If it is not treated, if you don't what do you say, you're just avoiding, and just not focusing on your this small things, like just ignoring these urinary tract infections and all these problems, then it might lead to a kidney infection also. So just once the symptom is started, and just go to your doctor, get a test done, urine routine, urine culture, and get yourself treated as soon as possible. So thank you for today, and we'll see you for more videos. Thank you.